Hi, my name is Araya Manker. This is my head-to-toe assessment for my CBE. This is the room scan.
Come in.
Hi, my name is Araya. I'll be your nurse today. I'm going to go ahead and close the privacy curtain and wash my hands before we get started, okay?
All right.
Close the curtain. Wash my hands. Can I see your bracelet?
Absolutely.
Can you tell me your name and date of
Trim
birth?
Manker 03/28/2006.
Is there any allergies that I need to be made aware of?
No, ma'am.
Any pertinent medical history?
No, ma'am.
Any pertinent family medical history?
No, ma'am.
Any surgeries?
No, ma'am.
Okay, what brings you in today?
I have a headache.
Okay, when did this start?
Yesterday.
Where's it located at?
Somewhere up in the front.
Okay. Does it come and go? Is it constant?
It comes and goes.
Okay. Can you tell me the characteristics
It's
of
like
this
a
headaches?
stabbing/throbbing pain up in my head.
Okay. And then, is there anything that aggravates it?
Loud noise.
Is there anything that relieves it?
Cold water.
Okay. Is there a specific time and day that it happens?
When I wake up in the morning and I go to work.
Okay. And then we're going to use a pain scale. So 0 being no pain at all and 10 being the worst pain you've ever been in. What's your pain today?
My pain's like a 3.
Okay, I'm going to grab some vitals from you before we get started. Now, I would take your temperature, but I don't have a temperature thing on me. So we're going to start with your pulses.
Yes, ma'am.
So I'm just going to take a listen, and you just got to relax.
Mm-hmm.
Awesome. I got 64 beats per minute and 14 respirations per minute.
Yes,
I'm
ma'am.
going to have you put this little pulse ox on. It's going to make you look like ET, but you'll be fine. Just relax your hand. Okay, you're at 99% on your pulse ox and 65 beats per minute on that. I'm going to take your blood pressure. Is there a side that you prefer?
My right side.
Slide this up. Oh, thank you for holding that.
Yeah, no problem.
Appreciate it. Okay, I got 102 over 58. Normal ranges are 120 over 80, so that's perfect.
Yes, ma'am.
Okay, so now we're going to start your neurological assessment as part of the head to toe.
Yes, ma'am.
So the first thing I'm going to do is assess you for symmetry. So I'm just going to have you look straight at me, and I'm going to check your head. Everything looks, skin looks normal, and the symmetry looks good. I'm going to have you raise your eyebrows. I'm going to have you puff out your cheeks. I'm going to have you smile. Maybe frown, shrug your shoulders. Awesome. So next I'm going to palpate the top of your head.
Mm-hmm.
So, and I'm going to shine my pen light in it, and you're going to tell me if there's any tenderness. I'm looking for any lumps or bumps or any lice or critters, okay?
Yes, ma'am.
Was there any pain with that?
No, ma'am.
Okay. Next I'm going to palpate your ear, and I didn't feel any bumps, just so you know. I didn't see any critters or anything. And again, tell me if there's any pain associated with any of this. Is there any pain with that? Okay, I'm going to shine a light. Everything looks pink the way it should on that side. Same thing with this side. Okay, I'm going to feel your face. Tell me if there's any pain associated with anywhere that I'm touching. Do you mind opening your mouth for me? I'm assessing for some clicking. I don't feel any clicking. Do you ever have any pain with chewing?
No, ma'am.
Okay, I'm going to take a look at your eyes. Do you mind if I brush your hair out of the way?
No, ma'am.
Okay, take a look at your eyes. checking your sclera, and everything looks good. There's no excessive drainage. Next, I'm going to assess PERLA, which is your pupils are equal, round, reactive to light, and accommodating. And I'm going to walk you through it, okay?
Yes, ma'am.
So first I'm going to check equal. Both of your pupils are at 7. Then I'm going to shine light in it. This is reactive to light. So I'll go in one side, then I'll go to the other, and we're just seeing if your pupils dilate the way they should. Awesome. Just look straight ahead at me. Awesome. They both did, which is great. I'm going to have you next. You're going to follow the tip of my pen with your eyeballs. Keep your head straight. Just follow it with your eyes.
Yes, ma'am.
Awesome. That looked great. And then I will have you stare at the tip of my pen. And this is the accommodation part. We're seeing how your pupils dilate when I bring this close to your face and farther away, okay?
Yes, ma'am.
I'm going to try that again, okay?
Sorry.
No,
I
take
just
your time.
I had some in my
You're
eye.
okay. Take your time. You ready?
Yes, ma'am.
Awesome. Those look great. And then I'm going to take a look at your nose. Do you mind putting your eye down? Awesome. I don't see any drainage. Do you say ah for me? Awesome. Your teeth look nice and intact, and there's no scarring and no bumps or anything. And you said you don't have any difficulty chewing?
No, ma'am.
Okay, awesome. So I would raise the bed on a hospital bed to 45 degrees to check for jugular vein distension. And then I would have you turn your head over your left shoulder. So you want to do that for me, and I'm going to check for jugular vein distension. I don't see any. That's great. So I'll have you move your head back. And then I'm going to check your range of motion. Can you move your head to the left? You push against my head.
Oh, my bad.
Sorry.
Your left is my
Yep,
right.
no, you're all
I get it
good. Okay,
confused all
and then
the
push
time.
against my hand. Okay, and then to your other side, and then push against my hand, and then put your head to the front. Push your head, not your whole body. Here,
Oh,
you in a comfortable position?
yes.
Okay, you lean your head forward and push against my hand, and then go the other way towards your back. And then can you roll your head for me? Is there any pain associated with that?
No, ma'am.
Okay, awesome. The next part that we're gonna do is your respiratory assessment.
Yes.
So what I'm gonna do first, we would normally look under the gown, is I'm going to assess and look for symmetry and look for if you're using accessory muscles while you're breathing. I'll do that on the front and the back. Then I will listen. Well, I like to palpate, then I'll listen, and I'll do that on both sides, okay?
Yes, ma'am.
Okay, everything looks symmetrical. You don't look like you're breathing with any accessory muscles. I'm gonna palpate a little again. Tell me if there's any tenderness ever.
Yes, ma'am.
Okay, so we do 8 spots in the front and 10 in the back. Now, every time I place my stethoscope, I want you to take a deep breath in and out, okay?
Mm-hmm.
And then do you mind scooting forward for me a little so I can do the back?
Yes,
And then
ma'am.
are you comfortable?
Mm-hmm.
Okay. And on both sides, the lungs sound clear and equal bilaterally, so that's what we want to see. Have you had any difficulty breathing recently?
No, ma'am.
And then do you have any history of asthma?
No, ma'am.
Okay. Next, we're going to do your cardiac assessment. So for the cardiac assessment, we're going again to look around and make sure that that there's no lumps or bumps and bruising or anything. And then I'll press around, okay? Palpate, sorry. So I'm going to check. And again, we would do this underneath your gown, but for privacy reasons, we're not doing that right now, okay? Everything looks normal. And again, I'm going to press. Tell me if there's any pain ever, okay? And there's 5 spots that I'm going to press, and I'm going to use the bell and the diaphragm on my stethoscope. So tell me if there's ever any pain again. And we do this for a clearer image. So I'm going to do it with the one side, and I'll say them as I'm going, okay? Aortic, pulmonic, Erb's point, tricuspid, mitral. And then I'm going to switch to the other side. Aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, so all your heart sounds sound strong and normal, and that's what we want to hear, okay? Next, I'm going to listen to your bowels, okay? So for the bowels, it's a little bit different. I'll have you lie back here in a second. I'll help you do that. I'm going to go underneath your shirt a little, and I'll let you know the rest once we get you into that position, okay? Because what we do is we look first, then we listen, and then I'm going to press around, okay? So, you ready to lay down? You can take your shoes off if you need to.
Okay.
So I'll help you lay down.
Oh, I feel so old.
Okay. We're going to, do you mind if I lift your shirt up?
No, ma'am.
Okay. And is there any pain in any area of your stomach?
No, ma'am.
Okay. So I'm going to start in a quadrant, and I'm going to go in a clockwise rotation. So sorry about that. So this is the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. And your bowel sounds were active in all 4 quadrants. That's what we want to hear. So now I'm going to palpate around, and again, I'm looking for any lumps or bumps, and tell me if there's ever any pain, okay?
Yes, ma'am.
Okay. I didn't feel anything, which is great. I'm going to help you back up, okay? Okay. Next, we're going to assess your upper body, and then we'll do your lower body, okay?
Yes, ma'am.
So I'm going to assess your temperature in your arms first, just to make sure everything is equal, because we always want everything to be as equal as it can be. You mind flipping those that way? Thank you so much. Awesome. Those are great. And then I'm going to listen to your pulses on both sides, just to make sure that they are both doing the same thing at the same time, which is, again, what we want. We want it to be equal. And they're both strong and +2. Awesome. You mind splaying your fingers out for me? I'm going to do cap refill. Now, we want this to be less than 2 seconds per spot that we do, okay? Listen to. I meant fingers, sorry. Listen to. I didn't mean to say spot to you. 2. 2. 2. 2. And your skin is intact, it's nice and pink, and it was nice and warm, which is what we want to see. I'm going to press for edema once you're done scratching.
Yes, ma'am.
So, look like this. And there was 0 pitting edema. We're going to assess for skin trigger. Okay, that looks good. And then now we're going to assess your range of motion. So, I'm going to have you stand up. Do you need help, Bob? You got it? Yep. Okay, so I'm going to have you raise your arms above your head. And then I'm going to have you bring them all the way down, and then bring them back behind your arms, and then do a circle for me. Awesome. I'll have you sit back down. Was there any pain associated in any of that?
No, ma'am.
And have you noticed any swelling in any of those areas up there?
No, ma'am.
Okay. I'm going to have you grip my fingers.
Yes.
As hard as you can. Awesome. Your grip is equal on both sides. I'm going to have you push away from me. Awesome. And then I want you to put your hands in mine, and I want you to pull me towards you. Awesome. So that looks great. That's what we like to see. We want to see everything be equal. So now we're going to do it with your feet, and I'm going to slide your shoes off, okay?
Yes, ma'am.
Okay, so again, I'm going to do the same thing I did up there. I'm going to assess for temperature. And again, the skin looks nice and pink and is nice and warm all the way down. It's nice and equal. And then I'm going to, the two places that I'm going to check up here, because I did your radial pulses up here, I'm going to do your dorsal pedal, sorry. And that is 2+ and strong. And then we're going to do your posterior tibialis. And that again is 2+ and strong, and that's what we want to see. I'm going to press your legs for edema. Okay, 0 pitting edema, and I'm going to give you a little pinch for skin trigger. Okay, I didn't see any. And we're going to do your cap refill on your toes, okay?
Mm-hmm.
So it's the same thing as before. We want it to be less than 2, and I'm just going to give you a little pinch on each one. Less than 2, less than 2, less than 2, less than 2. Less than 2, less than 2, less than 2, less than 2, less than 2. And then we're going to put your shoes back on for you, okay?
Yes, ma'am.
Put that in there.
Thank you.
And get that in there.
Thank you.
Okay, now we're going to do your range of motion. I'm going to help you up. And your legs. Okay, so I'm going to have you stand sideways because you are quite tall. So I want you to bring your leg up. I want you to bend it, and then I want you to put it behind you.
Straight
And-
bend behind me.
Yes, that looks great. And was there any pain associated in that?
No, ma'am.
And then I just want you to bring the leg up and back. Same leg. Yes. Okay. Now I want you to take that leg, and we're going to do circumduction, and you're going to take that leg and just put that hip in a circle. Awesome. Is there any pain associated with that?
No, ma'am.
Okay, now let's do the same thing with the other side. Again, we're going to bring it up, bend, back. And then we're going to bring it forward and back. And then circumduction again. Do a nice circle with your hip. And then you said there was no pain associated in that.
Yes, ma'am.
Okay, you want to take another seat for me?
Yes, ma'am.
Okay, are you nice and comfortable?
Yes, ma'am.
Now, at this point, I would say thank you so much for your time. I appreciate you helping me today. I would go update your care chart and let the provider know. I'm going to put all your safety rails up just to make sure you're nice and safe in your bed. I'm going to lower the bed to the floor so you're safe. And then I'm going to give you your call light, and I'm going to say, call me if you need anything. Have a nice day. Thank you so much.